Hey guys, welcome to another one of my YouTube live streams. As you can see, I am finally out of the hospital after a week-long stay. I'm feeling better, but I'm still on IV antibiotics for another week. At least I only have to run them twice a day though. Today I'm going to be reading Saving Destiny, Chapter 14. We last left Destiny headed lights and sirens towards the Children's Burn Unit ICU at New York Presbyterian Hospital. When her parents hugged her before the paramedics took off running with her toward the ambulance, they weren't sure if they'd hugged her for the last time. Alright, I won't let you hang in suspense anymore. I'll start reading now. We'll start with Bonnie, Destiny's mom's perspective. Saving Destiny, Chapter 14, Mom. By the time we arrived at New York Presbyterian's Children's Burn Unit ICU, Destiny had already been admitted and set up in a room. She was lying on the hospital bed with that same triple lumen central line in her neck that she'd had after the overdose on Aunt Pat and Uncle Charlie's medicine cabinet. It was an IV with three separate IV lines sticking out the side of her neck at once. They were hooked up to a whole bunch of IV bags of multiple sizes being run on different complicated-looking pumps. She also had an IV in her right hand and left forearm. There was a breathing tube in her mouth and some kind of holder on her face keeping it in place, and a ventilator next to her bed on a stand saying that she was on 100% oxygen, and some other levels and information that I didn't know how to interpret. In her right wrist, she had something that the nurse explained to me was an arterial line to keep track of her oxygen levels and blood pressure. It looked extremely uncomfortable. She was dwarfed by all of the electrodes and wires and blood pressure cuff and oxygen monitor on her finger. I noticed that she already had a bag of neon yellow IV nutrition hooked up to a pump and going into one of the lines in her neck. Sneaking out from between her legs was a catheter, draining very dark brown urine into a collection bag hung on the side of her bed. Destiny was mostly unresponsive, but opened her unfocused eyes when I called out her name. They had her in another one of those hospital gowns with cartoon tigers on it, but all I could notice was the bandaging that was wrapped all over almost her whole body to cover the rash/burns. A nurse and Alan both came over to steady me as I walked over to her bedside, or my legs would collapse right out from under me. The nurse explained that they were keeping her sedated so as she wouldn't wake up and pull out the breathing tube or be too uncomfortable. I put my hand on top of her small one that wasn't occupied by an IV and told her how sorry I was that I had not realized sooner just how sick she had become. Her eyelids fluttered. I knew she was in there. The nurse and then doctor explained to me that all of this awful mess was a direct result of the Lamictal. If it had been caught sooner, it could have been treated by simply discontinuing the medication, treating with topical antisteroids, oral antisteroids as well, anti-itch cream, and oral Benadryl. Well, through her J-tube at least. Because it had progressed this far, she now required 24/7 care in the burn unit ICU for children. They had already discontinued the Lamictal, which she should never, ever, under any circumstances, take again. And now they would be daily cleaning the burns to remove the dead skin and apply a topical antibiotic ointment with silver in it, and rewrap and apply the dressings. She was also being treated with IV antibiotics, IV fluids, IV nutrition, IV steroids, IV Tylenol for the fever, and IV pain meds around the clock. They taught us how to use her dilaudid PCA pump and explained to us how the reaction had made her severely anemic, so they were giving her a blood transfusion, and that her liver had taken a big hit and would have to be followed closely for at least a year, if not longer. We expect to be able to wean her off the ventilator within the next week or two, but right now her body is just so overtaxed that she can't manage to breathe, fight and heal the burns, deal with the painful burn treatment, maintain her weight, deal with the anemia, and deal with the liver dysfunction all at the same time. We are helping take some of these issues away by providing a pain PCA pump, administering high-calorie TPN, providing blood transfusions and meds to protect her liver, but we are also helping her breathe and keep up her oxygen levels by breathing for her with the ventilator. Alan and I took turns sitting vigil by her bedside for 2 weeks. We would read her Harry Potter and other books we knew she loved. We would play her favorite music, like the Fight Song by Rachel Platten, Crash and Burn by Savage Garden, as well as I Won't Back Down by Tom Petty. They seemed to fit the occasion, and she seemed to respond to them. We turned her TV on and had Child Life, the staff in children's hospitals who help the kids cope with being in the hospital, bring her stuffed animals that we would tuck in bed with her next to Blinky, and play her favorite movies like Finding Nemo, Finding Dory, both versions of Happy Feet and Up, which we played for her over and over because we kept telling each other we saw her smile at different funny parts, even if it was just wishful thinking. We also talked to her a lot as well. After 2 weeks, Destiny definitely began responding to us. Her vital signs began stabilizing. Her fever had resolved. Slowly, they were able to lighten up on her sedation and wean her off the ventilator. Sorry, guys. And transition her to lower and lower amounts of oxygen via masks and then through her nose, finally to just needing 3 liters of oxygen through her nose. Her burns were healing as well. Most of her labs were looking significantly better, but the anemia persisted, and she'd had several more transfusions. Her liver still wasn't right either, but she was making remarkable improvements. They moved her out of the burn ICU onto the regular pediatric burn floor. Alan and I cautiously felt like we could breathe again. Destiny. We're switching now to Destiny's perspective. I felt like a truck ran over me, saw me, backed up over me, and ran me over again. Floating in my head are brief snapshots of memories. Having someone lean over me, feeling a cool mask with air blowing out of it getting placed over my face, and feeling a sense of brief, intense relief. Having my mom and then dad lean over to hug me. Being in an ambulance that had its lights and sirens on. Getting put on a bed in a hospital. Having a lot of tubes and wires hooked up to me. Having people ripping my skin off with some sort of cleansing pad, and then telling me they were going to give me more pain medicine. In between everything was just that same floating in a murky blackness that I experienced after some of my overdoses. When I finally woke up again, I was in a hospital bed. My mom was sitting in a chair next to me. I was covered in medical equipment. My mom looked up at me. "You're awake, Destiny?" she asked me. "Yeah," I said. My voice came out all froggy and broken. "I am so happy you're awake. A huge smile broke out across her face. How long was I out? I asked her, confused, thinking she was going to tell me a few hours, or at the very most, a few days. 2 weeks, she told me. She must have read the expression of pure shock on my face, because then she filled me in on everything that had happened. I knew it wasn't just heat rash, I told her. So did I, she said. Everyone at the Jackson Center feels awful about it. Your dad wanted to sue them, but I really think they can help you, and we need to find a way to help you. I don't think there's anywhere else that can help you is the problem, my mom said. So you think I should go back there? I asked incredulously. Yes, but from now on, I think they will listen to you when you say that you don't feel good. I know they will listen to me from now on, my mom explained. I just nodded my head. For the next few weeks, I had to endure painful debridement, where they scrubbed away the dead tissue from the burns, and then applied Silvadene cream to all the burnt tissue, and redressed it with gauze. There are no words for how excruciatingly painful this was. I had to bite back screams as I went through this, and then pounded away at my dilaudid PCA pump. Slowly, my wounds were healing, and the dizziness was improving. After a 6-week-long stay at the hospital, I was finally discharged 22 days before my 17th birthday. An ambulance brought me back to the Jackson Center and unloaded me in the front hallway. My arms were still covered in gauze. So were my legs, feet, back, stomach, chest, and bottom. The nurse was going to have to bring me over to the treatment center once a day to change my dressings, debride the wounds, apply the silver ointment, and redress them. She would also have to give me Pedialyte to run through my J-tube at 150 ml an hour for 3 hours every morning before starting my tube feeds. My prednisone had to be crushed up and put through my J-tube with my other meds. Someone had to bring me to the medical complex once a week for lab draws to follow my liver function and blood counts. The nurse had strict instructions to check in with me at least 3 times a day and ask me how I was feeling. Part of these specific instructions was that she had to listen to my reports about how I felt and allow me to rest if I needed to. My mom had shared with me that the day I was rushed to the hospital, Lori had handed her a file, and that was intended for the doctor to fill out, and it had said that I was obsessively worried about a mild heat rash, and that it seemed like I was more searching for attention than anything else. It went on to say that the appointment that day was just to placate my mom, who still needed more education on managing my manipulative behavior. Once I got back to the Jackson Center, everyone was so happy to see me. They all hugged me and told me how scared they had been when they found out how sick I was. The staff apologized to me profusely. "You just keep telling us how you feel," Samji said. "If you start to feel unwell, you let us know, and we will immediately get you over to the treatment room with the nurse. We're just getting to know you. Some of the reports of your history are misleading. We're really sorry for not believing when you told us you didn't feel well." I nodded. Sorry wasn't anywhere near enough, but I would take it. I knew they meant well, and deep down, I knew it wasn't entirely their fault. I knew my old therapist Mary at Windtree Hospital had written reports about me that made me sound like a completely different person. They had those reports and were taking them into account when interacting with me. It would just take time for them to get to know me better and make their reports just based on me and the reports from University Hospital, Haverford Hospital, Tessa, Dr. Wallace, and my parents. My first few days back, they had me stay home back from school and just hang out, lying down in my room, resting and writing on my laptop, reading, playing my Nintendo Switch, or watching TV on my laptop. Becky stayed back to watch me from my doorway and walked me over to the nurse when I needed my dressings done and meds. After a few days, we all decided I was ready to go back to the summer program, just at my own pace. Now that I was working in the snack shop, as opposed to gardening outside, it was easy for Meg to give me jobs that didn't require too much physical exertion. She would have me do things like count and organize the money in the cash register, or sit down and chop tomatoes. The banter between Meg and Kat kept me laughing all morning as well. Becky brought me to my follow-up with Dr. Langley a couple of days after I got home. Dr. Langley first told me how relieved she was to see me alive, and told me how close I'd come to not making it. I noticed that she stared right at Becky while she spoke, even though her words were directed to me. Then she went on to explain to me that my liver was still not functioning properly, and that my blood counts were still extremely low. "You may need to get another transfusion," she informed me gently. "I'm going to have you see a hematologist-oncologist and see what they have to say. I'm also going to write you a note that says that you need to be able to rest at the nurse's office when you get tired. I know you must be tired with your hemoglobin and hematocrit looking the way they do." I nodded my head and thanked her profusely. At least at school, Dr. Langley's note ensured that I could rest comfortably on the nurse's cot. That was the best part of the day, when it was just me on the nice clean cot with sunlight streaming in through the windows and Blinky tucked safely under my right arm. No one bothered me there. The nurse went on with her usual day-to-day activities, and I just rested calmly, drifting in and out of much-needed sleep. My mom visited every day, which was reassuring. Becky was the one who took me to my hematology-oncology appointment. It was in a building devoted entirely to cancer patients. Becky and I took the elevator up to the 3rd floor and went down the hall to the children's clinic. There were a couple other families in the waiting room. Several of the kids had no hair. One kid had some type of IV line going into his chest. It reminded me of the one that I'd had when I had just been in the hospital myself. Just mine had 3 tubes instead of 1, trailing out of my neck. That had felt so weird when they pulled it out to discharge me. I was aroused from my memories of getting my triple lumen central line pulled by Becky moving. She had gotten up and was playing the pinball machine in the corner of the waiting room. My cheeks flushed with embarrassment that the 60-something-year-old lady who was with me was playing the kids' pinball machine. "What are you doing?" I asked Becky. "Playing pinball," she told me, and laughed. I sighed. Sometimes she was more of a kid than I was, and I was the one with the developmental delay. Even though my IQ tested in the genius range, my developmental age was 10. "No!" she yelled angrily when she lost the game. She yelled so loud that a nurse rushed into the waiting room to see what was going on. My face burned a deep red now. I stared toward the floor, pretending to be intensely occupied with the toe of my light-up unicorn sneaker. "Oh, sorry," Becky laughed. The nurse looked around the waiting room another moment, and then went back inside. The oncologist-hematologist called us in after about half an hour in the waiting room. "So I understand you have been suffering from Stephen Johnson syndrome," he stated. "Yeah," I nodded. Well, I've looked at your blood work, and you definitely have low red blood cell counts, hemoglobin, and hematocrit. I'm going to have you start getting iron infusions, since you can't take iron pills by mouth, and they won't crush up to go through a J-tube and work correctly. We'll schedule your first infusion today. We're going to test your blood today, and again after your first iron infusion. If the iron doesn't raise your levels enough, then we'll have to have you come in for a blood transfusion, he explained to Becky and me. The nurse had set me up with an appointment for the iron infusion for 3 days later. The drive back to the program was fairly uneventful. Becky chattered nonstop, as always, talking about how if I shaved my head before I went back to the children's clinic for my next appointment in a few days, they would think I was a cancer patient too, with how emaciated I was. And then maybe someone would send me to Disney World on a one last push trip, and she could come along with me and push me in a wheelchair so that we could get privileges to ride all the rides first. She could be rude and definitely embarrassing, but I had to admit that she was very funny and amusing. Sometimes she could even be nice. The thing was, you never knew what was going to come out of her mouth. Becky took me up to my next appointment at the Children's Cancer Center 3 days later. I was super nervous because I'd never had an iron infusion before. Plus, I knew that they were going to have a really tough time getting an IV in my tiny used up and scarred over veins. For once, I welcomed Becky's embarrassing antics. They were a good distraction at least. You ready for me to shave your head so that we can go to Disney World, she asked me. I think you could pull off the bald look very well. I smiled and shook my head at her. The nurse called me in, and it took 4 different nurses and 8 sticks before they got the IV in with a vein finder. After the iron infusion, they drew my blood. You're still very anemic, the hematologist-oncologist told me, but your levels are definitely improving. I'm going to have you continue getting iron infusions once every 2 weeks for the next 2 months, and then we'll switch it to once a month for the rest of the year. We'll just keep monitoring all of your levels. We can hold off on the transfusion as long as your levels continue to improve. On the way home, I was so happy to be done with my infusion for the day. I was so relieved that I didn't have to go back for a whole 2 weeks, that I was even able to joke around with Becky. Did you beat your high score in the pinball machine this time? I asked her. I think I just might have, Becky smiled back at me. With my blood levels improving, I was finally starting to feel better. I had a little more energy, and I was definitely less itchy. I was feeling pretty good. The good feeling didn't last too long, though. The calendar at school showed the date, and I realized that my 17th birthday was in about a week. As soon as I realized that, I felt like a little kid who had just gotten a nice big balloon and then had it pop. I'm scared, I admitted to Eliza at our therapy session. I know. We're going to work through this together, though, Eliza promised me. I'll help you through this, and the staff at the house will help you through this. You're not at all alone. And that is the end of chapter 14 of Saving Destiny. I hope you enjoyed the chapter. Please don't forget to share, subscribe, and comment. The more you guys share, subscribe, and comment, the more my writing gets out into the world. I have this disease called Shigaraga syndrome, also known as multiple system atrophy. I was diagnosed with it in 2018, and people with this diagnosis generally only live 2 to 10 years post-diagnosis. It's now 2022. I'm trying to get as much of my writing out into the world as I can before I pass. And You guys can help me with that. You guys can share my videos, subscribe to my channel, comment on my videos so literary agents and publishers are more likely to pick up my work and my books and stuff. So please share, comment, and subscribe. I'm so glad you watched this video, and I'm going to stop here. Thanks, guys. Love ya.